The Health Quality Council of Alberta's Quality Exchange highlights positive things happening in Alberta's healthcare system. In the HQCA's 2017 Long-Term Care Family Experience Survey, of 36 facilities in the Edmonton zone, Sherwood Care was ranked by family members as the #1 facility. What are they doing differently to achieve this result? One meaningful program they provide is an indicator of their emphasis on family experience.
Long-term care, the average lifespan in the province is about a year, and we're maybe a year and a half. So out of 100 residents, you're going to see big transitions. And it was a January, and we had I think 5 or 6 deaths in a 10-day period in January. And we actually brought in grief counselors for the staff because the staff really expressed this profound sadness and just felt like we were asking them too much to continue to provide care. You know, they lost people that were meaningful, people they built relationships with, and now we had to admit new people and start all over again. And so I think that's where it triggered for us that we needed to look at our process. And so the protocol was really kind of put in place with the chaplain we had at that point in time, the CEO at that time, this vision of a more dignified way to allow that process to occur that honored both the resident passing away, the families who supported them, and gave the staff a chance to grieve that loss. So that's where it started. And it was really around making a conscious choice to not be secretive about a resident passing away. That it's when a new resident comes in the building, we actually have a welcome committee. We, make a big deal of their first day in the building, and then their last day in the building, we kind of sneak them out the back door. That's what we did. And so we really looked at that process to try and change it. And we got feedback from residents that was very direct, that they didn't want that to happen. They didn't want to be shoved out the back door because they came in the front door. They wanted to go out the front door. So listening to all that, we put together this protocol that allowed for that public, dignified exit of the resident, remembering who they were, what we knew about them, honoring the family and their wishes, and including the whole team and the residents in the building as part of that final farewell as they walked out of the building.
So when a person at Sherwood Care passes away, we implement what is known as our Dignity in Death Protocol. And that's something that has evolved over time. The basics of it surround the idea of continuing to care for the resident's body the way that we did for the resident when they were still alive. And so at the point of death, if there's family present, we give the family time to just be with their loved one, to have that time of grief, and then we, when the family has given us permission, we begin to start the process of preparing the body to leave the building.
A rose is placed on the door and on their bed, and that room is kept empty for 48 hours, and it allows the staff time to grieve. It's hard when you have a couple people die maybe in a short period of time, but you still have to work. You're still caring for other people. So it's a way of how I'm gonna deal with that for each person. One of my favorite things is our procession. So when the funeral home comes to get our resident, we have a special blanket. It was handmade, and it's a beautiful quilt. It goes over top of the shroud that they would normally have on. An announcement is made that our friend is leaving the building for the last time, and anyone who would like to pay their respects to come and stand in the hallway. And so the families walk behind the funeral home, and we're walking with them all the way out, and they're so touched to see the hallways lined with the staff members.
We used to not have many families that stayed when their resident passed away, when their loved one was gone. I would say more often than not that now we have families that stay, and it's a rare family that won't stay and walk with us all the way out. So for the families, the fact that we offer it gives meaning where they would not have necessarily known there to be. But for the staff, it gives a meaning that they couldn't put their finger on but recognized needed to be given. And the same with the residents. It adds a meaning that they sense should be there. And now that we've done it, they really couldn't see it any other way.
I remember one family, we were walking out in the procession, and she couldn't believe the people that were standing in the hall honoring her mother. And I just whispered to her, because she said to me, "I can't believe this." And I just said to her, "Look behind you." And there were about 15 to 20 people behind her, and she was so moved. She felt loved, she felt taken care of, she felt like she could still lean on us.
For staff, I think we start to recognize that we're not just caregivers, that we're humans, and we develop these meaningful relationships with residents, and we provide intimate care for them, and we get to know about their lives, and we just get a little snippet of their life. But for the staff, we really appreciate being able to share these last moments with them.
We had a gentleman here who, he was cowboy of cowboys. He had belt buckles from the Calgary Stampede. He'd actually been to England, had taught the royal family to ride. He was a legend in his own time. And he had told us some of those stories, but his wife had been able to tell us more of them. So when he passed away, the staff made sure that his cowboy hat, his favorite one, was on top of him as the procession was leaving the building. And the funeral person, the director who had come, was watching all this. He'd heard the staff talking, and the wife was sharing. And so as he got to the door, just as they were going to take this gentleman out to the hearse, he said, "Ma'am, I want you to know that this cowboy is going to listen to country music for his final ride." And it was just so, I think, there's me, crying, but I remember it because it was such a meaningful experience, because he got it. This person who doesn't know our building or our people was in the environment long enough to understand what this meant, and he was contributing in his own way.
It's bittersweet, because here are these amazing people that come in. We get to know them so well, and their families, and they become a part of our family. The staff, we consider each other family. It's nice to spend time with the residents and to get to know them, their families, what they did for a living, everything about them. And we become so attached that when they do pass, it's hard for a lot of us. It's not just the loss of the resident, it's the loss of their families too. We've become quite close to many, many families that have been through the care center, and we remember them, and we remember their loved ones that were here, and we talk about them to this day. They're not forgotten.
I think it's vital to an organization like this for long-term care, because these individuals have lived long, meaningful lives, and just to have a resident pass away and that's the end doesn't seem to do justice. And I think that if we're looking at providing dignity and respect to the individual, to their families, and to staff, that continues forward not just when they're living, but as they're dying and when they pass away. It can't just have a stop right then and there, and they continue to be a person that needs to be remembered and who should be remembered, and that who was important to so many of us.
It's a beautiful thing. Families, residents, staff, all being given the opportunity to really have a meaningful farewell to somebody that they've loved and cared for. Even though it's a very sad time, I can't tell you how many times there have been smiles and laughter through the tears, simply because we've given the space for that to happen.